Everybody, and you're all very welcome to the session on national strategies to address homelessness. My name is Eoin O'Sullivan, and I'm the moderator for the session. But I've been also asked to give a very brief overview of homeless strategies across the European Union. To structure this afternoon, I'll give a very brief overview of the strategies across the European Union and some questions around the purpose and origin of homeless strategies. But I think some of the questions that I raise can best be answered by detailed case studies. So firstly, we will have the case study of the development of homeless strategies in Finland, given by Nicholas Fleece, who is a very unfinished name because he is based indeed in the University of York, where he's a senior research fellow at the Centre for Housing Policy, and he also works with the European Observatory, and indeed has led a number of projects on homelessness in various European countries, and his most recent work with Dennis Culhane and other colleagues from Finland has been a review of the Finnish homeless strategy. So I think that presentation from Nicholas will help give some flesh to some of the ideas and the purposes of strategies. That will be followed then by a presentation by Ashwin Puruklar, who I think helps us take us outside of a certain comfort zone that we tend to look for answers to some of our questions within the dominant paradigm, in our case, of the European Union. Of course, I think getting a case study of what's happening outside of the European Union, indeed from India, I think will help provide some further information and knowledge for us to work on. Ashwin is the project head of the Knowledge Centre on Urban Homelessness at the Centre for Equity Studies in New Delhi, and he has worked previously on work relating to hunger and the right to food, and is the co-editor of a forthcoming book on debates on the right to food in India. We look forward very much to his presentation. So what I will do at the beginning, my name is Eoin O'Sullivan. I'm Professor of Social Policy in Trinity College in Dublin, and I'm the editor of the European Journal of Homelessness, and work with Nicholas on the European Observatory of Homelessness. So what I do, I do a very quick overview of homeless strategies in Europe to provide some context for our debate and discussion this afternoon. These are a range of homeless strategies across Europe. They're all very nice. Some of nice pictures, women and children, flowers and various things. And what we have across Europe is that a relatively small number of countries in the European Union actually have a homeless strategy. Mainly, as you can see, centred on the north and the west of Europe. We also have Portugal, Greece, and the Czech Republic, but they're relatively recent additions to the families that have homeless strategies. But certainly around Eastern and Southern Europe, to a degree, homeless strategies are not yet widely adopted. Just in terms of their development, we can see the first homeless strategy emerging in England in 2005. It gets a bit complicated at that because then with devolution there are various strategies for Northern Ireland, for Wales and for Scotland. But nonetheless it's interesting that it was in England in 2005 that we had the first strategy. Followed by Norway in 2006, and then they had a renewal of that policy in 2014. Followed by the Netherlands 2006, and again a renewal policy in 2010. Ireland 2008, and a renewed policy in 2013. Finland 2008 and 2012, and now another one for 2015. France in 2009, not renewed. Germany has a regional strategy only for the Länder of North Rhine-Westphalia, but is the most populous Länder in Germany. Denmark in 2009. Portugal in 2009, then Luxembourg in 2013, the Czech Republic in 2013, and finally Greece. So these are the countries that have adopted homeless strategies. And there's a number of observations. One is that, so first, the geographical imbalance, but secondly, and linked to what we were discussing this morning with Housing First, in one sense you may not be surprised that the social democratic countries of North Europe have adopted them, but mainly they came in under neoliberal governments. They did not come in under social democratic governments by and large. So it's a striking feature that the majority of these strategies are implemented and brought into being by right-wing conservative neoliberal governments, not the social democratic governments that you perhaps might expect. What they cover varies enormously, and this is a very quick schema overview of them. So a number of them talk about the need to eliminate rough sleeping. For others, it's about reducing the length of stay in temporary accommodation. Others, again, it's about improving the quality of services. The prevention of homelessness dominates, as does access to housing. So on the one hand, we said at the beginning that it doesn't necessarily match welfare regimes because I said Ireland, England and Wales were the countries that first developed these homeless strategies. So these are broadly conceptualised as liberal welfare regimes. So, and indeed in the Nordic countries where these strategies were implemented, by and large not implemented by social democratic countries. And indeed the case of Sweden is particularly illustrative. The policy was introduced in 2009 by a neoliberal government, and with the return of the social democratic government they have not renewed the strategy. The strategy has been in abeyance since 2012. Also there's no great link in the discussion we're having this morning about the type of, the dominant type of homeless services. Really only Finland and Denmark, we can say, have where housing-led or housing-first type models are dominant. So all the other countries that have strategies, by and large, the strategies have not changed policy, particularly our local practice, that it is still either that the housing-led strategy has been adopted, but not an operational reality. That's the case in France, Ireland, Portugal, and in a number of other countries where they have had strategies, it bears no, really policies have not changed at all. That's certainly the case in Sweden, Germany, and England. So I think some of the questions we might want to ask, what then is the purpose of these strategies? Given that, a bit like Housing First, it's striking in Canada, in the United States, implemented by governments that you, not from the progressive governments that you might expect, they're coming from liberal or neoliberal neoconservative governments. The strategy is very much the same. So there's one argument I think we could maybe debate later. One is that neoliberal governments are simply far more pragmatic. I think our French correspondents this morning talked about this, that we're now in a non-ideological policy environment. It's about what works rather than the ideology of it. Or else I think for critics of the neoliberal model, these strategies are a way of segmenting the social model and saying there's a separate group out there called the homeless who are different from the poor and the more general population. And I think in the case study of Finland was interesting. I think the term was homelessness is everybody's responsibility, which is more or less the same language they use in their national crime strategy. So there's a sense that this is government at a distance, this is somebody else's responsibility rather than the responsibility of the state. But it's interesting that there is this new category that deserves a strategy in its own right called homeless people, which in many cases is divorced from housing policy. So you have a strategy for homeless people, and separately you have a housing strategy, and it's almost that the two are not linked. But I think we're only beginning to think through. I think in many cases we were quite encouraged and excited by the fact that governments were adopting homeless strategies, and I think we hadn't thought enough about, well, what exactly do these strategies mean in the long run, and what does it mean for homeless services. So I think without further ado I can hand over to Nicholas, who will, I think, tease us through the Finnish strategy. Nicholas?
Hello. Yes, I'm an Englishman talking about Finland. And I'm in an unusual position today. Almost always describing something going wrong. So much so that a former colleague of mine once compared me to an indicator of deprivation, because whenever I went somewhere, it was indicative of strategic, structural and or other policy failure around homelessness and responses to homelessness. So today I'm in a slightly unusual position in that I'm reporting something that's actually a very positive story about a response to homelessness. 25 years of working in the UK has really instructed me exactly how to cause homelessness. I know exactly which buttons to push to put people on the street, to cause family homelessness, to cause youth homelessness, to cause other problems. So it was very refreshing and enlightening to have the experience of doing the work in Finland. Now I should begin by saying that this piece of work was actually a collaborative effort. It's listed as me on the programme, but it was myself, Dennis Carlhain, who's here, my Finnish colleague Rita Gangfeld, and a Swedish colleague, Marcus Nutegard. And it was a collaborative effort and a collaborative report. So I'm the one talking about it, but it was the work of all four of us together. So what the Finnish government did was bring together myself and my colleagues from Sweden and from the USA and from Finland itself. We had 2 visits to Finland by the international element of the research team. We talked to policymakers at central and local government level. We talked to homelessness service providers, and often, though not always through translation, to homeless people themselves about their experience in different kinds of services and settings, and visited those services. And then we also reviewed the data that were available on various outcomes around different elements of the strategy. So I'm not going to go into a great deal of detail. I will show you the links to the report. There's a slightly embarrassing full-length video of me talking about this for about an hour on YouTube as well, if you feel excited by what you hear today. But this is just going to be a quick overview. So Finland is the best example I've heard of as a truly coordinated national homelessness strategy. Now what that means is it brought together all the agencies and elements within elected government that had responsibility or could play a potential role in responding to homelessness into an integrated strategy. The politics involved in that, the political skill involved in that was very considerable. So it took a lot of work in the background to get that kind of cooperation happening. But it was achieved. So you had the homelessness NGOs all on board, all the homelessness service providers on board. You had the Y Foundation, which is the major provider of social housing within Finland, participating. You had also municipal and central government, again coordinating together. And what that led to was a comprehensive strategy. A strategy that began by focusing on what was termed long-term homelessness. And that's the group that those of you from European and maybe North American contexts would identify as repeatedly homeless, long-term homeless, sometimes use the term chronic homelessness to describe that population. So high rates of mental health problems, combined often with drug and alcohol use that's problematic, combined with criminality, nuisance behaviour and so on. So there was a focus initially on long-term homelessness, but the strategy was a comprehensive one, so they started to look at preventative services in a major way. And that ranged from advice services, that were just low-level advice, where to go, what kind of help to get, through to other kinds of interventions that would, for example, work with people to prevent an eviction from occurring. And many of those service responses were coordinated in the sense that they could work through case management, through service brokering to coordinate different aspects of the welfare system, the health system, social work systems and so on. So comprehensive preventative responses, also development of specialist interventions for particular groups, services for young people, services for former prisoners coming out, where the support was more tailored to specific needs and specific groups. And a range of housing-related, housing support services alongside the Housing First model, which was used in Finland. One of our main findings was that we were all jealous of Finland because their strategy was more coordinated and comprehensive than equivalent strategies in Sweden, the less united than it once was kingdom, and the United States. There was far more thought about coordination of these services in the way that I'm talking about. So you're talking about housing market, housing supply, social housing being integrated, health and social services being integrated, NGOs being integrated, and then this cooperation across the different elements within government to produce this response. And while there have been achievements in bringing down long-term homelessness, people on the street, you look at the example of London in the last 30 years, which has reduced its experience of rough sleeping to an almost residual level, but at colossal expense, both in a financial terms but also in political terms, in terms of the amount of effort that's had to go into that. Responses to long-term homelessness have been more variable elsewhere. There have been successes in Sweden, the US and the UK, but not as comprehensive as that we were finding in Finland. So while there are still challenges ahead in Finland, the reductions in homelessness that have been achieved compare very positively with elsewhere. Work that myself and colleagues did for the European Observatory last year, looking at the statistics and the state of knowledge on homelessness in 15 member states, found there was only one out of the 15 member states where homelessness was falling, and that was Finland. So you have a substantial success in reducing long-term homelessness at the core of what the strategy has achieved. So the most individually, socially and economically damaging form of homelessness has been reduced. Not accomplished on the same scale elsewhere, even if it's not unprecedented, as I mentioned. I've got the example of London. But one of the things you might have heard about Finland and the Finnish strategy is the way in which Housing First was implemented within that strategy was quite controversial, because it used a communal, congregate model as part of the response, rather than a scattered housing model. So I'm just going to spend a couple of minutes talking about what that appears to tell us about Housing First. Now, it is spreading across the European Union as an idea, and I myself am involved in a project to develop some guidance around Housing First in Europe, which is being led by Fienza. So I've got the not completely unchallenging task of writing guidance that works in Greece, Denmark, Romania, Finland, Wales and Ireland and all these other countries. What we're finding, broadly speaking, in terms of European experience, is that fidelity is not possible in terms of the detail of operation of Housing First, because there's too much difference in structure in terms of welfare systems, health systems, social housing and so on. The Finnish experience was to develop congregate and communal Housing First, sometimes out of existing buildings, sometimes out of existing homelessness services, by converting them from big buildings into apartment blocks which used a Housing First model, and only Housing First service users could live in those blocks. This was criticised as not allowing for social integration, because people were in a separate block, separated from the communities in a way that they're not in the original model of Housing First. And there was also criticism that bringing a lot of high-need people together in a shared building would create all kinds of management problems. Now, what we actually found in relation to this was experience in Finland suggested that both these issues could actually be managed, and that you could think about delivering Housing First using slightly different structures. Now, there is an open question as to whether or not higher fidelity to the original North American model would be still more effective, but the evidence from within Finland was that using a communal and congregate approach could also be effective, and that there could be benefits attached to that. So, for example, the schemes themselves could function as sources of informal social support by people who had shared experiences. And relationships with the external neighbourhood could be managed through dedicated support teams. What using this approach did in Finland was it meant that the Finns could produce an awful lot of housing relatively fast. They didn't have to try and find a way into one of the most pressured housing markets in Europe. I can speak from personal experience. Finland is a deeply expensive society. Housing prices are very high in relation to income, particularly in the cities. So if you were going to do something quite quickly about long-term homelessness, if you were going to find the housing stock to intervene, this was one way in which you could do it. Now, something that's an important point to make around housing first in Finland is, while the communal congregate model was used, there are other models also being used that employed scattered housing. So not everything was done in exactly this way, but this is the bit that's perhaps attracted a bit of attention internationally. So I'll just finish off by talking about what some of the key findings that we had. First one might be a bit of an obvious one, but let's say it anyway. Affordable housing supply is key to reducing and preventing homelessness. You've got to put people somewhere. And you've got to always be very, very careful around debates that see homelessness in terms of what support needs does this person have, what medical interventions are necessary in order to produce a stable person who can be housed. You've got to have somewhere to put them. You've got to have housing. You've got to start with housing. And as soon as you move beyond homelessness that's associated with high support needs, when you've got people with lower needs that may not be ongoing over time, housing becomes the most important thing at all points. It's arguable with some populations the pressing need actually might be psychiatric treatment above all else, and then you would need also to have housing in place. But housing is fundamental. Across Europe there is concern around high pressure housing markets. I grew up near London, where you will pay £500,000 for a 2-bedroom flat in a converted house, where private sector rents are £1,000 a month. You can all Google the exchange rates and be horrified as to how much that actually is, and what's livable in terms of housing costs in London. Where you actually have a situation where you have middle class households, in inverted commas, struggling to meet housing costs, because rather than 30 or 40% of their income, it's 60%. Then where does the money come for everything else? Because it's such an expensive environment in which to live. Partnership working is obviously crucial. I've been saying partnership working is crucial for 25 years. I'll probably be saying it for another 10 years before I eventually retire. But you've got to have this collaboration that I'm talking about, and it's got to be a collaboration which, from the Finnish experience shows, has to be all the agencies that are involved and need to be involved. It has to be all levels of government. It has to be coordination across everything that has an input to solving homelessness. There are some potential lessons for Finland in terms of experience from other countries. So, for example, one of the things I suggested in the report was looking at a model we have in the UK, which is called local lettings agencies, which creates a conduit, a route into the private rented sector for homeless people that reassures private landlords, but also works to ensure that reasonable housing with reasonable security of tenure that is within an affordable range is available to homeless people. So you can look at increasing housing supply and access to housing supply in those kinds of ways. prevention needs to identify people at risk of long-term and recurrent homelessness. Really difficult to do this in an accurate way. But that doesn't mean there shouldn't be effort going into it. Now, any one characteristic or set of shared characteristics, you say people with a mental health problem and problematic drug use. And you could say, well, that's a predictor of long-term and recurrent homelessness. But actually, most of the population in northern European countries with those characteristics will not experience sustained and recurrent homelessness. So there are other things happening as well. There are trigger events, there's personal experience and so on happening within that as well. But nevertheless, you have to think about where homelessness is likely to occur. And there are some areas where we do know that. We know, for example, that there's associations with being in the care system as a child. We know that there's associations with being in prison, particularly with certain populations within prison where people commit a lot of low-level offences and get in prison for short amounts of time, so that when they come out there isn't much aftercare in place. One of the things in the UK around prison populations is you can rob a shop 40 times and get fined for it and locked up and never get any assistance when you come out of prison after 2 or 3 months. If you do an armed robbery, you'll have a probation officer and support networks in place when you come out. So you have to do a quite serious offence before you get some help. There's all these kind of quite different ways of looking at things. Finland can also look at some of the experience elsewhere, so different models of housing first, critical time intervention around prevention and so on. Indebtedness is something that came out of the Finnish work, and it's something from the experience in the UK as well, how financial problems can be a precursor to homelessness. And there's scope, although Finland is already doing this to some extent, to look at lower intensity models, using mobile support workers, housing-led models, to provide support for people with lower support needs or perhaps transitional support needs. Obviously, having said about housing supply, housing on its own is not enough to solve homelessness. You have to start thinking about social integration. You have to think about an emotionally rewarding personal life, work, education, training, something positive to give structure to life, and being part of a community. And evidence points to social integration, to bringing people back into society as the way that we can reduce and prevent homelessness. Now that's something that the Finnish strategy thinks about, that's something that the Finnish strategy has incorporated within it. But you can still do further work on that. Because what homelessness is we all have a series of strings holding us up, like a puppet. And it's around having a predictable life, having security in life, having security at home, having access to informal support, friends, relatives, having a sense of being valued, having a sense of purpose and so on. And then all kinds of structural supports, ranging from welfare systems, through to social work systems, through to health systems, through to how the welfare system functions in the country. And we need all of those different things to hold us up. And losing more and more of those elements and not being able to counteract it is what causes homelessness. So it's about everything from barriers to services through to lack of informal social supports and other things. There is scope to improve the evidence base on Finland, because we did a quite broad overview, a couple of visits to things. There will be more attention at European level on cost effectiveness of services and cost benefit of services. So you were starting to see the kind of debates about, does this service represent good value for money, alongside does it have good outcomes in other ways. So that's something that will need to be looked at as well. The report is online at that, which is that address there. You can also find it on Dennis's website, my website, and I think Marcus and Lita will get PDFs links from their website as well. Thanks very much for listening.
So what I hope to do is, in telling the story of India's national policy response to homelessness, yes, in one way to present the actual policy response and then hold it up to say, is it working, is it not working, and by the time I get through this, it'll be quite obvious as to what the answer is. But what I think more importantly is to situate the story of that policy response into a larger context of the public response to poverty, endemic poverty in India, through the expansion of democracy in India. And I think that that is the important story of what has been happening with homelessness and what supports the specificities that we'll get into, and we'll see the obvious flaws that exist. But I hope to be able to engage you on the context of that response as one that is a working experiment in democracy, which has been happening in India since its independence. There have been discussions today or comments today about the urgency of combating homelessness because, quite obviously, as everybody in this room knows and likely has experience with, that living on the streets for many people is dying on the streets for many people. And this is perhaps, this characterizes the condition of homelessness in India. And right now, actually, there's a heat wave. Maybe some of you have read about it in the newspapers. And that heat wave has claimed about upwards of 1,500 lives in major cities. It's a travesty, and unfortunately, it's also a recurring story. The context or the precursors to those deaths sometimes are different. Sometimes it's hot weather, sometimes it's cold weather, sometimes it's demolitions. But what characterizes death is the insecurity of life in these environments. And that also forms the backbone of the story of the public response in India. And it is a response which has been rooted in a acknowledgement that in India, the Constitution was constructed to expand human freedoms in India. And to achieve democracy was not merely civil and political rights, but the expansion of human freedom through, yes, social and economic rights as the country developed economically. In 2009-2010, the awareness on the problem of homeless deaths increased, the pitch increased. One of the people sitting in this room was very instrumental in that, Prakash Singh in Delhi, part of human rights groups in the country. There were human rights groups, there were journalists, there were academics, there were human rights lawyers who brought this to a fever pitch to the government. So just to, we've also been talking about numbers and the importance of numbers. And in the last 11 years, 2004 to 2015, there have been about 32,000 deaths on the streets, unclaimed bodies on the streets of Delhi. By the way, that's New Delhi. It's the capital of India. And in the period since this story has taken place, meaning 2010, you could say October 2009 to now, 18,000 deaths on the streets have taken place. So cognizance of death, heinous kind of death, is what initiated, firstly, outrage, anger, yet channelized through the arms of democracy. In January of 2010, the Delhi court took this on their own accord because of the agitation that was created. And that month, the petitioners, an entity called the Supreme Court Commissioner's Office on the Right to Food also filed a petition with the Supreme Court to say that the deaths were in violation of the constitutional right to life. Just, if I could just, I don't want to create a diversion, but it's important to explicate this context just a little bit. In 2001, there were several starvation deaths that had occurred in rural India at a time of grain surpluses, at a time of increasing food production, yet at a time of defunct social programs. These social programs were food, nutrition, public works programs. Many of these deaths had taken place in areas where there was blatant disregard for those programs. So what happened was a group called the People's Union of Civil Liberties filed a petition to the courts saying that the failure of those programs to work was a cause of death for hungry people, and therefore that's a violation of the constitutional right. The court then decided that the right to food via the access to those programs is inherent to the right to life. Now that's important because traditionally the right to life had been a civil and political right. This is the first time in India's history that a socioeconomic right has been introduced into a historically civil and political right. The homeless deaths then became part of that story. The petitioner said that in the failure of the state to house these, provide shelter to these people, to provide food through these social programs that are there, nutrition, is also a violation. So the courts then took that on as well. So I just wanted to frame that context to say that that is the jumping off point of homeless policy in India. So the nitty-gritty, the mandate at that time, we've heard a lot of housing solutions to homelessness. And in India, context just, I suppose it's a little different, and the mandate is shelter in terms of homeless shelters. The Supreme Court ordered that cities above a population of 500,000 construct shelters, one shelter for a capacity of 100 homeless people in jurisdictions of 100,000 population. That was then revised later on in 2013 to cities with a population of 100,000 should be doing that. And because it was in cognizance of the right to life with human dignity, the courts also said that shelter should be a place which promotes such living. Therefore, they should have access to the things that assure such dignity: water, sanitation, access to public health facilities, drug de-addiction centers. These were, yes, they were aspirational, but they were also administrative. They were also to be implemented. Now, I just mentioned the continued expansion of the constitutional right to life. So this is the wording later on of there are several judgments, but this is the wording, and just to direct the attention to, a large number of judgments have laid down the right to shelter is included in the right to life. So while this is the first time the courts said that, okay, this is correct and we should do something about it, over the years, the last 30 years, there have been judgments that have taken on violation of poor people's rights to live and interpreted certain socioeconomic rights in this right. And this is the first one that started that process in the early 80s. So this has been an ongoing story. What happened in 2010 has, the beginnings start some 30 years earlier. And these are called public interest litigations, where petitioners have a right to approach the courts on the behalf of masses who themselves cannot do that of their own accord. Just to provide context, that means when India won independence in 1947, the life expectancy was 35 years old. The average literacy rate was 8%. By the 1960s, half of the population lived in abject poverty. So even though it was established as a democracy, access to the channels of democracy was largely because of the standard of living for so many people out of reach. So this was a mechanism introduced by judges in the late 70s to ensure that there was some access. So over time, and the cohering rights to shelter, or those cohering rights which made the right to shelter part of the right to life, were on the backbone of other court cases. Right to livelihood is a right to life, non-implementation of laws banning bonded labor, limitations on the rights of homeless people to rehabilitation. So in other cases, there were times when the court said there are limits to what we can do, and over time, such similar cases kind of grouped together and led to that change, which now exists. So then the challenge, of course, which has been the challenge for the last 5 years, okay, how do you translate a constitutional right into a practical policy response? That is, all democracies face that, and particularly one as complex as India, which is trying to ensure political will through the courts. You mentioned that it was surprising that in a neoliberal regime, housing or policies for the homeless came about, and I think that that's relevant especially in India, where there are when the pendulum shifts and there is no political will to ensure basic amenities for people who are largely excluded, that the response by the courts ensures that there has to be some mandate. That's how it sort of works. So the nitty-gritties of how many shelters are required, how do we know how many people there, those are questions that had to have been taken then, and there are questions that still exist. And as you can see, the surveys of homeless people, as in Speak and Tipple's work, so the variance is so great that it's almost useless here. And there's one that's not on here, which is 16,000, which is by a nodal agency just this past year. So, the other problem is that where do you draw the line between homelessness, people living on the streets, and those who are already living in precarious conditions, which also could be life-threatening or public health hazards? More than half of the population of Delhi lives in such conditions. And the citation of this is from Siddharth Agarwal's work, who's a public health scholar in India. And so these are more than half already live in unauthorized settlements, slum-designated areas. So in policy prior to this already, homeless people were not even acknowledged, even though they're highly visible, especially in Delhi. There are many, many places you cannot avoid people living on the streets. When the notion that housing shortage is becoming a problem and has to be addressed by policymakers, then there had to be a disaggregation of who are those groups. And the government had to acknowledge all such groups. And here we have the number is about 19 million people. Sorry, the shortage of 19 million housing units, of which the homeless are about 0.53%, and most of it is people living in congested housing. It's not that there had not been any public policy responses beforehand. There had been, but they were inadequate. The identification, not just of homeless people, but the urban poor, is actually a relatively new thing. Measuring who is poor in urban India was just a matter of applying old measurements across the board, which did not do anything. And this is now becoming a critical factor because India is becoming more urbanized. Now, by 20 years, more than half the population will be in the cities. And India has traditionally been a rural society. Today, there are 377 million people in the cities out of 1.2 billion, but that number has rapidly changed. So the idea of identifying who's poor, identifying what the needs are, has become only of late a critical issue. So there are positive responses, there are negative responses, and positive responses, which the previous slide showed, didn't work because implementation was faulty. Negative responses are implemented, unfortunately, and these are the Prevention of Begging Acts, where homeless people have been taken off the streets and put into beggars' homes, and this still happens today. Now, another thing that has shaped homeless policy, and it is the shelter policy. It is shelter policy. In India, when you talk about policy response, it's only shelter policy. But what has shaped that, in the sense of what kinds of shelters, what kinds of amenities should be there, have been progressive thinkers and government-appointed expert committees who tried to wrangle with these questions. One of them was the Hashim Committee, which in 2012 acknowledged that previous responses had not worked. The reason that is because not enough is known about such people. It's important to know the precise nature of the vulnerability and deprivation that they face is also the extent of the deprivation, absolute and relative. So they came up with the matrix of 3 types of vulnerabilities: residential, environmental, those people living in precarious conditions; social, yes, gender-based, those who are part of socially vulnerable groups, such as certain castes and tribes that have been historically subjugated and exploited; and occupational, which is a key vulnerability, especially for the urban poor. Most of the urban poor work in the unorganized sector. In India, 90% of the economy is in the informal sector. There is no security, there are irregular wages, and there is a lot of exploitation in the networks that determine the extent of work and the conditions of work. So in 2013, as a part of homeless policy, the National Urban Livelihood Mission was launched to ensure that, okay, you have shelters that are built. Those shelters should be linking the people to some form of empowerment, some form of livelihood. Because it's understood that most of the homeless are working poor. Most of the homeless in India, yes, they work in the cities. Their labor goes into the building of the cities, infrastructure of the cities. So this policy was to ensure the access to shelters, firstly, that those shelters should be located strategically in areas where these people work, and they should provide services such as mental health care and for vulnerable groups. This was the intended coverage, even though the coverage of the homeless, 900,000, is still quite less. Now, I'll just talk about if that worked or if it didn't work in a little bit. So at CES, what we thought we should do is to engage with the current. Our mandate is under the shelter policy. That is our mandate, to understand how to engage with this and to understand the conditions of the people who live in certain situations of homelessness. And so some of our recent research is trying to contend with this. So livelihood, trying to understand the skills, the capacities of the men on the streets. So we just completed a study that we'll put out in about a month or so. In a sample of 100 men, yet 90% are employed in the unorganized sector, 10% are unemployed. Now the key finding is that, one of the key findings is that many of these men have employable skills. Many of these men come from parts of the country where they were apprenticed to some kind of position, tailoring, carpentry. Many of these men had been employed somewhat safely back home. Something happened, social strife. A lot of times it's not possible to understand exactly what happened, but they ended up, because of economic straits, coming to the city to earn and couldn't make it. So of this high percentage of men who have some employable skill, work as day laborers, casual laborers in very extreme, unsafe situations and conditions. And then barriers to work. What are the barriers? Most people do not have identification, and of that, 63% of which don't have the information on how to get that identification or the means to get that identification. This I just wanted to note here. When we talk about vulnerabilities, we talk about deprivations. We talk about the condition of living on the streets is akin to a near death on the streets. It's important to understand the inequality of health outcomes and health access, basic needs that afflict people, they're urban poor. And I'm just putting up this here to show that of the lowest income, this is not even homeless people, this is just the lowest income bracket in urban India. The lowest income bracket in urban India has far higher rates of health, worse off health indicators and access problems than even the next bracket, and of course the average. And in Delhi, the lowest income bracket has a much higher deprivations in health. So before I wrap up here, I just wanted to, if we're working within the shelter policy, which is what exists now, so how do we evaluate that shelter policy? The National Advisor on Urban Homelessness has conducted this report, and it's a survey of many cities' homeless shelters. Now, the number of required shelters are per the guideline. That's one shelter per 100,000. In cities of 100,000. The capacity of 100 homeless people. So this shows you, even on the basis of what is supposed to exist, where the where the gap is. So in each of the cities, there are a lot of problems with implementation. The quality of the shelters, the number of shelters that exist, and the capacity of the shelters. So this right here, this is the difference in the required and current capacity of the shelters. These are how many homeless people are not covered in even shelters. So even in the shelter model, there are huge gaps. So where do we stand right now, even with the judicial process? In last month, the courts had deemed that the National Urban Livelihood Mission scheme is not working at all, really. So what they have asked is for each state to submit their expenditure reports and to pretty much to do something about it. And last month also, the Delhi High Court closed the case on shelters. So anything that happens in Delhi will now be included only in the Supreme Court case. Just to wrap up, these are just kind of questions that I would hope to put out there. Obviously, because of time, these things, it's not possible to engage in conversation. But I'm just hoping that, to put this in the context of perhaps what else is going on in other countries in the context of approaching homelessness through democratic institutions, expansion of democracy, as squarely as a human rights issue, which therefore then there are constitutional precedents for these things. And what are the drivers and other, second question, similar drivers in other country contexts, whether that be developing countries, whether that be countries who are battling with informal and formal labor, because many of the drivers that we see in India, when people live in the streets, yes, it's obvious that they're economic drivers, but those economic drivers have different faces. There's migrancy, there's the conditions itself of informal labor, there's broken families which lead to people not yet equipped to earn, having to be forced to earn. And then lastly, what can countries who remain hesitant about recognizing and ensuring social and economic rights learn from those who have taken steps to combat homelessness and urban poverty through such means? Currently, India is no shining example of a country that's combated homelessness. What it has done is to voice or to acknowledge that the infringement of the rights of homeless people warrants democratic response and expansion of democracy. Whether that it's an imperfect experiment and the results remain to be seen, but I'm interested to learn what other countries are looking at it from that perspective. So, thank you very much.
Thank you very much, Ashwin. We have about, I don't think we have a coffee break. I think we go straight into the next session. According to the program anyway, but we'll probably finish about 20 past for people want to have coffee. So I'll open it up.
Oh yeah, this is a question about India and the discussion that's going on now. About 35 years ago in New York, there was established a right to shelter. And Bob Hayes was the lawyer at the time who established that right in court. Headed up the New York Coalition at the time. And there was a lively debate in the early years about whether that was a good thing or not. You know, everyone was proud and thought, oh, this is wonderful that we've got this. But those of us who were trying to get people into housing, what we worried was that if you have a right to shelter, then all of the public response is getting people in shelter. And I think that that's what happened. New York is really a basket case even today. And they put billions into housing, but they put millions and millions and millions into shelter. And I think they never were able to get themselves focused on a real solution. So I'm wondering whether that debate is even possible in India. That's really the question.
No, I think that's a very valid point. Right now, it's been announced that the Prime Minister has announced that there would be an effort to do away with the housing shortage. There's this thing called smart cities, and there's a lot of debate on what that actually means. But there hasn't been any backing in policy, so to speak. And I think for the homeless, it is right now restricted to shelter, and so it goes both ways. Where we should be talking about, yes, we should be talking about housing. We should be talking about going at social integration, but it is locked. It's stuck there. So I guess it remains to be seen.
I think from the Finnish experience, also kind of Northern European experience, it's about not defining it in terms of a right to shelter or actually a right to housing. It's about getting to the point where it's a right to citizenship, where it's about the right to have the same opportunities, the same chances, the same supports as everybody else, because you have to think about the housing aspect, you have to think about social integration in a broad sense, you have to think about health and well-being. And unless you're addressing all of those issues, you're not really going to get anywhere. One of the experiences in the UK where we had very progressive legislation in 1977 which gave certain bits of the population the right to housing if they were homeless, was that certainly around single adults with support needs didn't work, because you gave them a house, but then you weren't dealing with all the other stuff that could be present, which could mean, and it resulted in things like the house that you gave them, they'd run into management problems, they didn't pay the rent, they'd abandon it, because you have to think holistically, you have to think in terms of the social sense, in terms of health and well-being, as well as housing. It's about that wider integration into society that you have to target.
So you then?
Yeah. In fact, I'm glad that Ashwin has brought in many dimensions from India. I just want to mention here, in a sense, we have been working on homeless for the last 15 years. One thing which comes up very clearly, because you can see, the contradictions that were there, in the approach to homelessness as such. It comes up very clearly that in India, we have two Indias. One is India and other is non-India. And India is where you have got the democracy and the constitution of India, and you have all the properties and riches and everybody. And this is non-India, where you've got the Dalits and tribals and Muslims and homeless, where much of the acts and all do not actually apply. And in the 15 years of the work that we have done, I want to say here that even the criteria that came up of one shelter per 100,000 people, it came up in around 2004 when about 7,000 homeless put a memorandum to the Delhi Development Authority that we wanted shelters at places where we work. That's how the clause came in, and Supreme Court used that clause for the country as such. The issue really is that I think somewhere we need to also discuss and debate that if in India we got a robust democracy, then a government should be performing and the courts should be coming only at the last resort. And if you see the Supreme Court coming in, the High Court coming in, and that too, say the High Court which came up in 2010, it came up because we as a network that's called Urban Rights Forum for the Homeless, we were clamoring for last so many years, and when we had the media support, and then nothing was happening, we had of course Milind Kothari, the former UN Special Reporter, supporting us and all. It was primarily when homeless were dying on the streets, we raised a press conference, called the media and all. That's when the High Court came in a sumo action. So what is happening in India at the moment is that we have a model of governance where so far as the executive is concerned, they don't deliver, and we allow the courts to come in and chip in and govern, which I think is a flawed model of democracy. And at the moment in Delhi, which is the capital of the country, there is a deficit of 87% of shelter space. So somewhere, I think, surely we have got shelters happening in Delhi, because shelters are opening up in the cities as such, all across the country as such. But I think also this issue where your friend was talking about, we are talking in terms of housing continuum, which starts with the shelter, ends with housing. It is not just shelter at all, So, and as Ashwin was talking about, our Prime Minister, who the world now knows around, who globetrots, is busy trotting the world than being in the country, talks about housing for all by 2022 of some 25 million housing. And when we met the urban minister recently, we asked him, by your declaration, you need to construct 8,500 houses per day. What technology you have to construct that houses? He said, yeah, we'll meet and discuss. So I think somewhere the issue is they are fooling around.
I'm going to take about 3 or 4 questions before I go back to panelists.
Yeah, I had a question about India. If this construction and use of shelters at least had alleviated the burden of mortality, because
that's a very good question. Actually,
already a result.
I mean, just in Delhi, it doesn't seem that it has. It does not seem that it has.
Deborah?
On average, about 3,000 deaths a year, and that's before and after shelters.
Okay, so having worked with Ashwin and doing ethnographic work on pavement dwellers in Delhi over the past 15 months, first I'm going to say, Ashwin, I don't know what you mean by democracy making a difference since Modi got elected.
Yes, yeah.
Okay, so there's that. India may vote for what India votes for. I think the issues in India are so structural that they almost beg any kind of realistic conversation. But one thing I see in India that I don't see is in all developing countries is fabulous wealth. Fabulous wealth. People living with billions and driving 30 Maseratis, etc. So there is, the income inequality in India is beyond anything. I doubt there's a country in the world that has the level of that inequality. Delhi has 25 million people. There's no way you're going to tell me there's only 50,000 of them are homeless. This is a place where you see families, where you see infants living. Anyone who's been there knows what I'm talking about. One thing that we saw time and again, which is not politically correct to talk about, but is overpopulation. And the fact that women that we studied, homeless women, have no control over their reproductive lives, 0. And they're as likely to have a child from rape as they are from any type of consensual relationship. And women's problems are often related to their reproductive and their poor health and homeless women. And I think until India comes to grips with this rapid population growth without any consequent countermeasures of housing or population control or any of these types of basic services, I don't know what's going to change, but it's pretty scary to me.
Take one more here.
You finish study. So, you gave us various categories of homelessness, but what I don't hear in the discussion is the root cause of homelessness, especially in Europe. I don't understand because I come from one of the poorest cities in the world, and we do have just sheer poverty. Fiction is one of the things, but joblessness, ability to pay rent, etc. But it would be good to know why in Europe and this well-to-do European city homelessness happens. I mean, I lived in Britain for 12 years, and some of the homeless used to say to me, "Oh, I don't want to run at home with social security," and I compare it to my country, and this is like really abusing privilege you have. You could use it and so on. And they will tell you their reasons, which is not wanting to run a home, not to take responsibility, not to do this and that. But I wondered if you have many more reasons as compared to ours, which is poverty and literally, as I said, eviction, and the rehabilitation part also, which I wanted to hear from you, is I found that coping mechanism for very poorest, whether it is in homelessness and other things, is actually fatalism. And Paulo Freire's big philosophy, fatalism. I just wanted to know, in Europe, well-to-do country, what prevents rehabilitation to actually go back, besides just moving houses. You know, just giving a house and saying just moving doesn't, I don't think, come readily possible.
Okay, I could talk for the rest of the conference about the causation of homelessness in Europe, because it's not as simple as one simple factor. A big difference between Europe, particularly Northern Europe, and some other parts of the world, is because there are very extensive, generous welfare systems which provide a basic income to any citizen that's without work. There's a lot of structural homelessness that is linked to income poverty in other contexts, does not occur. So if you look at homelessness in my own country, in Scandinavian countries, in France, in Germany, from some perspectives it can look residual because it's a very small part of the population that actually experiences homelessness, both in terms of experience at any one point in time, but actually globally. You know, almost everybody in the UK does not experience homelessness, and that would be true of a lot of Northern European countries. Now, in terms of what the causation of homelessness is, it's unlikely to be a single factor. It's about economic position. It is about social integration in the sense of what support somebody has available. So we're held up by various things. We're held up by our economic position, our job, our capacity to earn money, which gives us one set of tools to cope in society. We're held up by family, by friends, by social support that is in place. We're held up by welfare systems, health systems, other things that protect us, particularly when the other two things are not in place, when there is no job or where there is no family or no friends. Quite often what we find when homelessness becomes prolonged or is recurrent, happens many times, is that all three of those things are going wrong. So there is not a good economic position. It's somebody who finds it difficult to find work. It's not a good social position. There's not family, friends, all the kind of social support in place. And it's also structural in the sense that systems are failing. So we have experience of long-term and repeated homelessness throughout the economically developed world, throughout OECD countries as well as the European Union, where you have experience of homelessness by people with severe mental illness. Now, for me, that association is about systemic failure in mental health services. It's not about a characteristic as such. It's about why is this person in this position when there should be systems in place to help them, because there are designed to be systems in place to help them. So there's multiple causes. I also think there is an element of luck, an element of chance and trigger events also within that, which can explain why homelessness occurs. So I'm giving you a long, complex, vague academic answer. Sorry.
No, it's okay, because we, psychosocial rehabilitation, I think, in all this is very important. I was very spoken, because I do that when I work with the very poorest. Even when the situation is there to solve a problem, is the beneficiary who rejects it because of having created a coping mechanism living in that kind of situation. So I was wondering if in Europe have the same problem.
There are some who argue that that is a factor. The evidence is variable on that.
Jim?
Yeah, just thank you for the presentation. Just sort of interested in this this decision in Finland to have more of these what they call congregate facilities, blocks, these large blocks. And you were saying that they serve their own kind of purpose in terms of social integration. And I wonder, are there cultural differences? Because I think one of the things that has driven the attractiveness of the scattered site housing first model, it's the values of choice, empowerment, and because and this goes back way beyond housing first coming onto the scene, and they would ask consumers in North America what type of housing you want to live in. I mean, 80% plus would say, well, just regular housing. I just want to, sometimes I want to live alone, and I want to live with somebody else, friends, or whatever. But I wonder, is there a difference in Finland? That, like, where do the consumers fit in their kind of choice?
Well, one point that's very important to make is what this looks like in an apartment block. So it does, and they have their own tenancies, they have their own front door. It's their own space, and they have the same housing rights as anybody renting housing. So what it looks like in terms of the physical building and what their apartment looks like isn't really different from anybody else's apartment buildings. The difference is who the neighbours are.
Do they have their own bathroom?
Yeah, it's a flat. It's an apartment. It's an apartment. So there's a bedroom, bathroom, kitchen. It's a ordinary. It's housing. It's very important to stress that it
probably
is
be
housing.
akin to public housing, let's say, in North America.
Yeah.
With blocks of public housing.
Yeah, although this wouldn't look that different because Helsinki is a city with a lot of apartments. Because it's a small urban space where land is at a premium. And you see the same kind of thing in London. In London it's not blocks, but it's large houses that were large houses and converted into flats. A lot of people live in apartments. So it's not a different housing experience in that sense. If there is a difference, we'll give up on that. If there is a difference, if there is a difference, it's around it being potentially identified as different. It wouldn't necessarily look physically different from the apartment block next door. It wouldn't have a big badge on it. It would be designed in a different way and be recognisably provisioned. Ireland's the same. There's still homeless services in the UK that are 19th century poor houses that have been converted, and they've still got that institutional look. The Finnish stuff does not look like that. And the other thing to stress is it provided a lot of housing very quick, but within a context where mainstream service responses, as Juha was saying, are very often scattered housing and mobile support workers. So it's not happening on its own, but there's also this much wider policy context in which scattered housing is also being used. But what this approach did was to allow them to generate an awful lot of housing very fast. So to make a real dent in the levels of long-term homelessness quickly, because they could rapidly roll out this housing.
Take two more questions, Mike, and yourself.
And thanks for both the presentations, but so a comment or as an invitation for a thought from Ashwin. One of the remarks that always struck me most thinking about homelessness and why it sort of persists is Amrita Sen's remark about famine. So I was fascinated by you linking it to democracy and food and hunger, where he said that no famine had ever taken place in a democracy. I don't know whether it's true or not, but it's a very striking remark. And so you're situating the debate about homelessness within that democracy and hunger is very interesting. And whether is this a sort of an extension of people's sort of greater public and acceptability of homelessness and putting it in a similar context to starvation, or is that too optimistic?
No, I think,
view?
I mean, just to go along, Drez and Sen and Drez, that I mean, there's been debate about famine not happening in democratic societies. But one thing I think is true is that public response through various channels does mitigate suffering. You know, Deborah pointed out that the suffering in New York is widespread and it is intense. And it is a result of widespread exploitation. But where I would contend with the fact that there are problems in India's democracy. Firstly, there are problems in India's democracy. But I think that as far as democracy being deepened, it doesn't merely happen through elections and civil and political institutions. It happens in various ways. And I do think that, I do also agree that it's not healthy for what they call it judicial activism to be the way in which the democracy has to function. But it's better than there not being any judiciary. And in a situation where thousands of people are dying from nothing, and they're suffering at the hands of people who either don't care or need them to be on the streets for, you know, whatever the working environment is, where the conditions of their particular exploitation is. That I absolutely think there's a thread with what at least Sen's conception of democracy is that it does happen in various parameters.
Okay, we take our final question.
I'm going to pass.
You're going to pass. We have time for one more if anybody else would.
Ashwin, this is my name, Stephen Kirkis. I'm very, as I'm trying to, I love hearing about solving homelessness in Finland. It sounds like a very kind of a technical issue where the right people need to get in the room at the same time and make sure the money kind of gets moved in the right direction. And then when you spoke, I felt a lot more like I was in my home state of Alabama, where you need a court order to get of resources spent to stop people from being raped in prison, and then if you don't get the court order, that'll just continue. But I wondered if you could just talk. Do you think that the legal rights framework is actually the avenue to addressing homelessness in India, or is this really just a situation where a much greater amount of money has to be generated by the society at large, or something much more?
Well, as far as the money being generated, I mean, the money is, just now the Prime Minister cut the social expenditure across the board. Money is there, it's allocated. Money is there, it's allocated towards priorities, towards human development. Now, as far as the first part, where you said that, is this the legal rights way? Is this the way? Well, I think that in any, in any democracy, the assurance of a legal right to some aspect of dignity, to some aspect of freedom, is absolutely essential. And it shouldn't just be enacted in the evidence of death. But in India, in the last 15 years, yes, or 30 years actually, yes, the courts have had to have been approached through this way at first as a last resort, and then as, you know, an acknowledgement that this is the only thing that is working many times. You know, I wish it wasn't that way. I really do.
Okay, thank you all very much for your time for this speaker.